Sometimes we get asked by listeners, can you please make your podcast based on trimesters or in chronological order of a pregnancy? Which I am sorry, after a few years in of publishing our podcast, the horses bolted on that one a bit. So we got to thinking, what else can we do to make it easier for our listeners? We have a solution. Pat and I have written a week-by-week newsletter which follows along your pregnancy and gives you tips and links to the relevant podcast and other value content we have published. Best of all, it's free, and you can sign up with your due date at growmybaby.com.au at any stage of your pregnancy.
The information in this podcast is provided for education and research information only. It is not a substitute for professional health advice.
If you're trying to get pregnant or you are pregnant and you feel a little bit overwhelmed by all you need to know, then this is the right podcast for you. Welcome to the show. I'm Brigid Maloney.
And I'm obstetrician Dr. Patrick Maloney. And this is The Kick, your expert-led podcast that delivers the essentials of growing a baby. Make sure you head to our website, growmybaby.com.au, to get some awesome free tools like our pregnancy knowledge checker to help you feel like you got this.
Welcome everyone, Brigid Maloney here. Now this is part 2 of Kareen's story. Last week we heard about her first birth, which for many women having their first birth describes some of the very common interventions that many first births have. In this episode, Kareen talks about her second birth, which is a vastly different birth, and as she describes, quite a healing birth. I think you'll really enjoy it. Head to our DMs at the Kick Pregnancy Podcast and tell us what you think. We would love to hear. And your second birth was very, very different from your first, wasn't it?
Extremely different, yeah. So, as I said, the pregnancy was pretty straightforward with him, despite having the pelvic girdle pain, which came on quite early. So it was probably around, I think, about 15 weeks or so. It started as a pain in my right glute, and then it progressively got worse, like to basically my whole lower back and my hips, and everything was painful. So, standing up and going to take a step to walk was excruciating. Yeah, sitting down, walking around, everything was extremely painful. So my whole pregnancy, I had to see a physio. They did things like massage, strapping my back, again, just giving me lots of exercises, things I should do, things I shouldn't do, how to get on and off the couch, how to get in and out of the car. I was told not to walk in my second pregnancy, which was tough because in the first pregnancy I walked daily, and that was something that was aggravating it in my second pregnancy. But I was doing Pilates. That was something different in my second pregnancy that I hadn't done in the first. So I think that was almost a year postpartum after Sophie, I started Pilates, and then I continued that all the way through till I think I was about 37 weeks pregnant with Noah. So it was great. They were able to modify that so I could safely continue to participate despite my pelvic girdle pain. And I think that helped me a lot in the labour and birth. So I got to 36 weeks pregnant with Noah, and I had a growth scan because at the 21-week scan, they had noted that he was measuring 9 days ahead of my estimated due date. So they said, let's do a scan at 36 weeks just to see how baby's tracking along size-wise. And that 36-week scan showed he was already 4 kilos.
Whoa.
And it wasn't just one measurement. It was everything, like his head circumference, his length, like the weight, everything was just completely off the charts. My partner, Scott, is 6'4", so he's big. So it didn't come as a complete surprise that, I could have a big baby on board. Having said that, Sophie was born right on 40 weeks and she was 3.59. So I wasn't quite expecting 4 kilos at that early stage at 36 weeks. But then, of course, discussions started happening about induction because, I was told that really from that point, for every extra week that he was on the inside, he could, put on another potentially 200 grams. So they were wanting to induce me as close to 38 weeks as possible. And I just wasn't sure what to do. From stories of friends that had either had cesarean births or had inductions, I knew a lot of them seemed to be more around 39-ish weeks. So I think that was my comfortable spot. I wanted to try and wait till close to 39. So we ended up agreeing on a date that was, I think, 38 plus 5. So I went in, 38 plus 4 to have the balloon put in. They had a bit of trouble getting that in because my cervix was quite soft and floppy, which they said was a good sign that, it was kind of ready to go. But I think they started off with, I can't remember if it was the Foley's or the Cook's catheter. Dr. Pat would know. But one of them had a soft tube and they had a lot of trouble getting that into a soft cervix. So then they changed to the other catheter, which had a harder tube, and they were able to get that one in.
Yeah, right.
Yeah. So had the balloon put in and I stayed in for an hour or so just to have some CTG monitoring and make sure baby was tolerating that, and it was fine. So then I was sent home, and that, like, pretty much from as soon as I got home, I had what I felt were like contractions, like pretty intense cramping and pain, and I thought, oh, maybe like this is going to kickstart things and it might happen overnight, who knows. But anyway, I went to bed and I had a really good sleep, which obviously I didn't get in my previous labour, where I had essentially like 3 nights in the end where I was awake. So I had a really good sleep, got up the next morning. I think I was due to go in at maybe around 7 a.m. or 7:30 to start the induction process. The balloon actually fell out at home in the toilet. Like, I got up and went and sat on the toilet and I'm like, oh, like, what's that? And it was the balloon came out. And
always a good sign. Yeah.
It was fine, but it was also quite confronting.
Yeah.
Almost the size of a mandarin orange, like this thing that came out. I was like, whoa, I wasn't expecting it to be that big. Like, it's kind of like one larger balloon and then like a smaller one on top of it. So that was a bit surprising. But yeah, I did think that's great that it's come out on its own. Like, obviously I dilated a bit for it to be able to do that. So then went into the hospital, got a check, and I was 3 centimetres dilated at that point. And the midwife broke my waters. I probably should have mentioned at this point as well that my second pregnancy, I was in a different care model. So I was in midwifery group practice, which meant that I had the same midwife the whole way through my pregnancy, the labour and birth, and for 2 weeks postpartum as well. So that was amazing and very different.
Very different. Yes.
So I had the same midwife, like I had her mobile number, and yeah, it was great to have that same person. But her backup midwife, who I had met during the pregnancy, she broke my waters. Like, we were trying to time it because my main primary midwife, she only had, I think it's like 12 hours that they're allowed to work. And then, they have to go off and have a rest. So we thought we'd start off the labour with the backup midwife, and then my primary midwife would come in a few hours later. So we did that. My waters were broken, and this time I had requested wireless CTG monitoring, which made a huge difference because it meant that I was able to be active. Like, I was determined with this birth. I do not want to be on that bed, like, at all. I don't want to sit on the bed. I don't want to lie on the bed. I just want to be able to move. So I had the wireless CTG and I sat on a fit ball, and that was like my zone for the whole labour. Like, I was on this ball kind of bouncing
up and down.
Yeah, had my TENS machine in one hand, and then I ended up using as well a wooden birth comb, kind of for a bit of pressure in my hand. Like, on the contraction, I'd squeeze this wooden comb really hard.
It helps you be distracted by the pain that's happening in your hand, doesn't it?
It just gave me something to kind of focus on. And so, I had my TENS, I had my wooden birth comb, and I was using breathing techniques this time. So it's probably hard for your listeners to visualize this, but I did what they call horse's breath, where essentially you have kind of loose lips and make like a sound. So that helped me to focus, and I guess to try and limit any tension that I was holding in my body, to try and allow, my cervix to relax and open. So I was doing that. And then as I got further along in the labour, and it was much shorter than my first labour, you'll be pleased to know. Like, I think, the waters were broken at 8:30, and I think I was in active labour by 1 p.m. And my baby was born at 3:22.
Yeah.
So it went a lot quicker.
And he was quite big, wasn't he?
He was, yeah. So like, when I got to that, that transition phase, and I knew that it was happening because I had that, like, I don't want to do this anymore. And my midwife was like, oh, you've heard of transition before? I'm like, yes, yeah, like, I know that's what's happening and that's the point that I'm at. And I did not want to get off this ball. And she's like, it's time to get off the ball. Like, you can't push your baby out on the ball. So she gave me a lot of options. She said, look, I don't mind. You can stand, you can kneel down, you can, get up on the bed. But because they were anticipating a big baby, I had been prepped about the potential risk of shoulder dystocia. And that was the whole reason why we had done this induction, because there was a concern because he was so big, or they thought he was going to be so big that his shoulders could get stuck. And that was why I consented to doing the induction in the first place. So I decided to get up on the bed and kind of kneel over the back of the bed, because I just thought if something happens where they need to quickly flip me over or get me in a position to help get him out, that was probably the best place to be for everyone. So yeah, at this point I've moved up onto the bed. They actually brought, and they asked me if this was okay, and I was fine with that. A student doctor came in at this point, kind of from when I went into transition to when I started pushing, to observe the birth, because up until this point she had only observed births in theatre. So they'd all been caesarean births up until that point. So they kind of wanted to give her an opportunity to see like a different birth. And I guess,
Excellent.
Thinking big baby, possible shoulder dystocia. So I said, that's fine. So she came in at this point as well and just kind of stood back and observed. And, I should point out as well, I didn't have any vaginal examinations during this labour. I had the initial one when my waters were broken and I was 3 centimetres dilated, and I never had another check.
No, because you were going along quickly. Yeah.
So different to my first, where I couldn't tell you how many times I had checked. But, I was up on the bed, and just so different to my first labour. I was, feeling these really powerful contractions. I obviously didn't have any medical pain relief on board at this stage. I hadn't used gas. I hadn't had an epidural or anything else. So I was very conscious of the contractions and when they were coming. And I had with Noah, like I think what they call like a fetal ejection reflex. So I just could not stop. Like my body was just going to push him out, and I essentially breathed him out. I didn't really have to consciously push him at all. And my midwife was just, you just do, what you need to do, you know what to do. And she had a lot of trust, and there was no coaching, and she just kind of let me be. And I just really breathed him out. So it was only 22 minutes, the like pushing stage, and, his head was out. And so then my partner, Scott, had been prepped that once the head was out, that, again, if it looks like his shoulder's stuck, like it was Scott's job to press a button and we would need, assistance to come in the room. So we still knew at that point there was the potential maybe for that to happen. But fortunately on the next contraction after his head was out, the rest of him came out. So
Fantastic.
That was such a relief at that point.
How exciting. Yeah.
It was okay. And I tried to pull him up to my chest, but he had a short cord. So I struggled to do that. So it's kind of helped to flip onto my back at this point, because I was still kind of on my hands and knees over the bed. So I flipped onto my back, and then I was kind of able to pull him up. But yeah, he did have quite a short cord. And he was great. So yeah, he's big. He was 4.37 kilos.
That's big.
A big boy. But he was healthy and alert. Again, he had the 9 APGARs straight away at the 1 and 5 minutes. So he was perfect. My placenta took a while to come out. And at one point the doctors did have to come in, because they said, look, we ideally like the placenta to be delivered within like 45 minutes. And it was getting really close to that time, and it hadn't come out yet. And there was even discussions at that point that you may need to go into theatre to have this placenta removed. And I was just thinking, oh no, like I've just gone through this
after all of that.
They revert. Matt did it without the epidural, and I've got this healthy baby in my arms, and like now don't tell me I have to go under and have this, placenta out. But fortunately, like I had a contraction, and with like a bit of the, the cord traction with one of the doctors, the placenta came apart, and it was a huge placenta as well, a big placenta.
No.
So it came out, and very minimal blood loss this time around. Like I think it was like 200 mils, and that was just from weighing the towels and things in the room. Like it was nothing really compared to the first time.
Awesome.
And when I hopped off that bed to go and have my shower, like my pelvic girdle pain was completely gone.
Yes, amazing.
My physio had said most of her patients, that's what happens. Like they have the baby and it goes away. She goes, I don't want to tell you that will definitely happen for you, because it doesn't always. But in my case, I was so lucky. At the moment I got off the bed, I just thought, oh my gosh, my body doesn't hurt anymore. And that was like such a relief after having, really like probably 6-7 months of intense pain to be feeling good. And, yeah, I had a great recovery after his birth as well.
It sounds like a very healing, positive induction to begin with, but healing birth as well. And I know that we say this a lot in our program, but sometimes it's the first birth compared to the second birth, isn't it, Pat?
Yeah, this is the whole thing. Kareen's story is fantastic because it really illustrates the very, very important difference between the first birth and all the other births, however many you want to have. And so often if people have had a difficult first birth, what's going on for them mentally approaching the second birth is that it's going to be just as bad or just as problematic or take just as long or be just as painful. And give or take, that's not the case. Kareen's baby was much larger than her first baby, like 50% larger.
800 grams, I think, like a kilo heavier.
Kareen's story is terrific because it really illustrates the importance between the problems encountered with typical first births or common first births versus that woman's second or third baby. And it's so important for us as obstetric caregivers that we put our efforts as much as we can and as much as is safe into helping a woman have, if possible, her first baby vaginally, if that's what she wants, because then the second and the third and however many babies that woman wants are likely to proceed much better. You look at Kareen's situation, her second baby was much bigger than her first baby, but came out in a labour that was much more efficient. Even with the issues related to induction, the labour progressed quickly in the way that second labours do, and then she was able to push out a much larger baby without the need for instrumentation because it wasn't her first go.
You must feel very proud of yourself, Kareen.
Yeah, I was proud, and just it was, as you say, Brigid, a very healing experience after that first birth that didn't kind of go the way that I thought it might have, which is often the case with a lot of first births.
That's the thing. And we do have this image in our head on how a birth has to go or how we want that birth to go. And you're not alone in telling that story. Your first birth is a very common story that a lot of first-time mums have. So, if this story helps anybody to understand that, don't give up. Don't think that your body failed you. Don't think the system failed you. You got there. And you have your second birth as the healing process. It's a really great story.
Another reason I wanted to share the story was I know personally I had a lot of fear about the induction. I hadn't had that with my first birth that had started spontaneously. And yes, it was augmented, so I had that happen later on in the labour. But with the second pregnancy and then finding out that I, would need an induction, I was quite anxious about that because you hear so many horror stories that, it's going to end in a cascade of intervention or you're going to end up needing to have a cesarean birth or, I guess I wanted to share my story to say that's not necessarily true and that inductions can be a positive experience and you can have a great birth because I just would hope hearing this story might help another mama to not feel anxious and worried that induction is necessarily going to have any negative impact on her birth, because for me, it was a really positive experience. I reflect back on that birth as I've been doing a lot recently with my son just turning 1. It all back to you, and I only have positive memories of that day. It was
fantastic,
really healing, amazing experience. That second birth, which I'm so grateful that I got to experience.
That's beautiful.
Brilliant.
Thank you, Kareen. And thank you so much for sharing both those stories with us. As you said, I'm sure people will get a lot out of what your experience has been. Thank you for giving up your time to share that with us.
Thank you for having me.
Really appreciate it. Thanks a lot.
Thank you, everyone, for listening to Kareen's story. I'm sure anyone that's heading into having an induction or even, first-time mums, these are all important stories to share.
Just so generous of her to share a story like that.
Yeah.
And hopefully there's some wisdom in there for everybody.
Yep. So she mentioned pelvic girdle pain. We'll put a link to our podcast about that. She mentioned induction. We'll put a link to that. There's lots of resources that we've got. And obviously she mentioned the GrowMyBaby program. So if you want week by week help, it's like having a visit to an obstetrician every single week. I really highly, highly recommend that you come into our program. That's at www.growmybaby.com.au, and we would love to be helping you out there. All right, everyone, have a great week. We'll be back in your ears next week. So until then.
Thanks for listening, everybody. Bye-bye.